Hello, my name is Staff Sergeant Guerrero. I'm with the Anatomy and Physiology branch. Today we'll be talking about the anatomical structures of the heart, both internally and externally. The heart is located in the mediastinum cavity. The mediastinum cavity means that the heart lies between the lungs. It is bordered then laterally by the lungs, which lie on each side. Then in front of the heart it is bordered by the sternum, and behind the heart it is bordered by the vertebrae. There is also a double wall sac that goes around the heart. This double wall sac protects the heart every time the heart contracts. So the heart contracts vigorously, thus there isn't any friction occurring because of the serous fluid that is inside the pericardial sac. The next thing we're going to talk about then is the layers of the heart. The layers of the heart then consist of, 1, the epicardium. The epicardium is known as the outer layer of the heart. It sits directly on top of the heart, so it covers the heart surface on the outside. The next layer is the myocardium. As I open the heart model to show you, the myocardium then is the middle layer of the heart. Notice that the myocardium involves basically the whole heart. However, it is responsible for the contractions of the heart. So we have myocardium throughout the whole heart. Again, it is the middle layer of the heart. The last layer then is the endocardium. The endocardium layer is known as the inner layer. It lines the chambers or cavities as well as forming the valves. So again, it is composed of endothelium tissue. Now let's go ahead and talk about the chambers since we have the heart open. We have the upper chambers, which are known as the atrias. These atrias then are known as the receiving chambers because they receive the blood. The lower chambers then are known as the ventricles. The ventricles are known as pumping chambers because they pump the blood out of the heart. Now on the outside of this chambers is a deep groove that is known as the coronary sulcus. The coronary sulcus runs between the atria and the ventricles, so it separates them. Now the auricles on top are part of the atrias. Their main job is basically to increase surface area, and they do resemble doggy ears. They're kind of like flaps. They kind of just drape over the heart. So that's only on the outside that you have the auricles. Now let's go ahead and go inside the heart again. The heart, its chambers are divided by septums. Up here, between the atrias, is one septum that is called the interatrial septum. The interatrial septum then divides the right and the left atrias. Thus it forms two chambers, making the right atria and the left atria. An important characteristic of the right atrium is the fossa ovalis. During fetal development, it was known as the foramen ovale. It was to shunt blood straight to the developing lungs of the fetus. And upon birth, it closes to become known as the fossa ovalis. The other septum then that lies internally is called the interventricular septum. The interventricular septum separates the right and the left ventricles. So it lies right in the middle, and it is composed of myocardial tissue. The next thing we're going to talk about are the atrioventricular valves. The AV valves, as you can see, are located between the atria and the ventricle. You have the right AV valve, or atrioventricular valve, which is called the tricuspid valve. It is composed of 3 cusps or leaflets. Their job is to prevent backflow of blood from the ventricle to the atria. The tricuspid valve has supporting structures. Notice the red streaks or lines here. These represent fibrous cords that are called chordae tendineae. These chordae tendineae stretch all the way down and mount to some muscles that lie inside the ventricular walls. These muscles then are called papillary muscle. You will notice that they look like mounds of tissue. They attach directly to the chordae tendineae. Together, when the ventricle gets filled up with blood and gets ready to contract, they will signal then and pull taut on the AV valve, being the tricuspid valve. The rest of the floor inside the ventricles, both, is called the trabeculae carneae. They form the floor or the wall of the ventricle. You can see the trabeculae carneae all around the myocardium. On the other side, we have the other AV valve. It is called the bicuspid or the mitral valve. Again, this AV valve is composed of 2 cusps or 2 leaflets, bi for 2. And it works in the same fashion as the tricuspid valve. The next set of valves that we're going to talk about are called the semilunar valve. You have a semilunar valve on the right side that is called the pulmonary semilunar valve. Its job also is to pass blood to the pulmonary trunk. So the pulmonary semilunar valve brings blood from the right ventricle. So when the right ventricle contracts, the pulmonary valve then will open up and send blood up through the pulmonary trunk. A characteristic of the semilunar valve, the pulmonary, is that both the pulmonary and the aortic, which is way down in here in the left ventricle, are both composed of 3 leaflets or 3 cusps, and they work more with pressure. They don't have any chordae tendineae or papillary muscle attached to them. So again, the key word here is that they work with pressure, a very high resistance pressure. So again, your pulmonary semilunar valve lies at the base of the pulmonary trunk. The aortic semilunar valve lies at the base of the aorta. Now let's go ahead and talk about the blood flow of the heart. Where is it that blood is coming into to circulate through the heart? As I close up the model then, I will then show you the blood flow through the heart. The first step is blood comes in through the superior vena cava, which is right on top of the atria. It also comes from the inferior vena cava, which is below the right atrium, and then it also comes from the coronary sinus, which lies on the posterior aspect of the heart. These 3 bring blood to the right atrium. So blood comes into the right atrium. From the right atrium, it has to pass through the tricuspid valve. From the tricuspid valve, then, blood will flow into the right ventricle. Once the ventricle gets filled up with blood, then, the ventricle is getting ready to contract. At that time, the AV valve will close up, and blood will then go through the pulmonary semilunar valve. When it goes through the pulmonary semilunar valve, it'll go through the pulmonary trunk. This pulmonary trunk then divides itself into two pulmonary arteries that take blood directly into the lungs. In the lung, then you have the exchange of CO2 and nutrients into high-rich O2, which is what the heart and the body needs. It comes back through these four pulmonary veins that you see here in red. These four pulmonary veins bring blood, oxygenated, back into the left atrium. The left atrium then receives that fresh oxygenated blood. It then goes through the left AV valve called the bicuspid, and then it comes right down into the left ventricle. Again, once the left ventricle fills up with blood, the AV valve will close up, preventing backflow, and then blood will go through the aortic semilunar valve, which then goes directly into the aorta. The aorta then takes blood to the rest of the body. The last thing that we'll talk about then is the circulation of blood through the heart muscle itself. There are two coronary arteries. You have the right coronary artery that travels in the coronary sulcus between the atria and the ventricles, and you have the left coronary artery that is also between the atria and the ventricle. Let's go ahead and talk about the right coronary artery first of all. The right coronary artery then, as it travels in the coronary sulcus, will divide. It'll divide into the posterior interventricular artery that goes all the way behind the heart. The posterior interventricular artery then supplies blood to the right and left ventricle posteriorly. The other branch then is the marginal artery that comes toward the right ventricle. This then supplies oxygenated blood to the right myocardium, or to the right ventricle. Let's go to the left coronary artery. The left coronary artery only comes out a short distance from the aorta and divides into the circumflex that travels all the way down in the coronary sulcus between the atria and the ventricle. The circumflex then provides oxygenated blood to the atria and the ventricle itself, the diaphragmatic portion of the ventricle and the atria. The other branch is the anterior interventricular artery. As you can see, it travels right down the middle of the heart between the right ventricle and the left ventricle. Again, this artery then supplies oxygenated blood to the right ventricle and the left ventricle anteriorly. Last but not least then is the coronary sinus. The coronary sinus is an enlarged vessel that sits posteriorly in the heart. Its job is to receive the oxygenated blood. That is, all the blood that has been used up by the heart muscle then is low in O2, therefore it joins into one enlarged vessel, and that's called the coronary sinus. This coronary sinus then brings blood directly to the right atrium. In conclusion to the heart, we have discussed the anatomical structures both internally and externally. We have talked about the location of the heart. We've talked about the mediastinum, the pericardial sac. We've also talked about the chambers, both atrias and ventricles. We've talked about the septums, the atrioventricular valves and its supporting structures, the semilunar valves. We talked about blood flow through the heart, what brings blood to the heart, and how does it come out. And we also discussed the heart's own circulatory system. This concludes then the discussion of the heart.